Hey everyone, welcome back to Greg's Natural Health. If you've ever felt a crushing weight in your chest and wondered, is this it? This video is for you. Back in early 2021, I was staring down the barrel of an angioplasty, a stent, a hospital gown, and a surgeon who casually mentioned a small risk of dying on the table. That single sentence lit a fire under me. I said no to the procedure and yes to reversing my heart disease the hard way. Today, 4 years later, I'm angina-free 99% of the time, down 30 pounds, and stronger than I was in my 30s. No stents, no statins, just science-backed lifestyle changes and targeted interventions. Stick around. I'm going to walk you through exactly what happened, what I did, and the clinical evidence behind every step. This is my story. No medical degree, just a guy who read a lot of studies and refused to give up. If you've ever felt that chest squeeze and thought, is this heartburn or something else? This one's for you. Hit that like button if you believe the body can heal itself, and let's dive in. Winter 2020-2021 was brutal. Gyms locked down, I was working from home, stress eating, and barely moving. Come March, the sun peeked out. I laced up my sneakers for a brisk walk, first real exercise in months. Less than a half a mile in, a burning pressure clamped across my chest and into my throat. I stopped, thinking, heartburn from that late night pizza? Next day, same route, same burn. Third day, worse. I ignored it the first few times, classic guy move, but then I noticed this only happens when I walk uphill. That's not heartburn, that's angina. Your heart screaming for oxygen because arteries are clogged. I hopped onto a telehealth talk to a nurse call that evening, described the symptoms. The nurse didn't hesitate. Call your doctor first thing tomorrow. This could be unstable angina. Next morning, I call my primary care doctor. They prescribed 2 meds without even seeing me. That's apparently how urgent it was. Nitroglycerin, the little pill under the tongue for emergencies, which I've never used, and metoprolol, a beta blocker to slow my heart rate. I started the metoprolol that day and later learned you can't cold turkey it. Rebound tachycardia is no joke. And my doctor referred me to a cardiologist. Cardiologist visit, stress test. 5 minutes on the treadmill, I could feel that pain in my throat. The results? Ischemia. The monitor shows my heart starving for blood. The cardiologist comes in and says, I'm writing you a prescription for a statin. Schedule angioplasty. We'll snake a balloon up your artery and pop in a stent if necessary. Quick procedure. Then we'll prescribe another anti-clotting drug that you'll have to take for 6 to 12 months. I asked what the risks were from the procedure. He said, well, there's a tiny risk of, not waking up. I asked, are there any non-invasive options? He shrugged and said, not really. Stents work fast. It'll be fine. That night I went home, opened Google, and typed alternatives to angioplasty. First hit, EECP, Enhanced External Counterpulsation. I called dozens of cardiologists within 100 miles. Most said, never heard of it. Then I found Dr. Mike, a functional cardiologist just 15 minutes from my work, who actually did EECP in his office. What is EECP? Imagine big blood pressure cuffs around your calves and thighs. They inflate in rhythm with your heartbeat, squeezing blood back to your heart during diastole, when your heart relaxes. It's like giving your arteries a workout from the outside. This creates shear stress on arterial walls, releases nitric oxide, and opens collateral vessels. Think of it as natural bypass surgery without the scalpel. Over time, your body grows new backup blood vessels, natural bypasses. The science? Big studies show 7 out of 10 people feel way better after 35 sessions. Some even ditch their nitro pills. I signed up. 35 one-hour sessions, 5 days a week. My insurance didn't pay for it, so I paid out of pocket. The clinic worked with me, and I believe I paid around $2,000 out of pocket for 35 visits. Expensive, yes, but not that expensive if you don't want to go through angioplasty or have a heart attack. By week 4, I could walk a mile without the chest squeeze, and by week 7, I was smiling on the treadmill. So, EECP gave me a second chance. Now, I had to earn it. Here's what I changed: simple, doable, and backed by real studies. 1. Intermittent fasting, the 16-8 method. I started skipping breakfast. I eat lunch around noon, dinner by 7 p.m. That's it. No snacks or drinks other than water, black coffee, and unsweetened tea outside of my 8-hour window. I do a 36-hour fast about 4 or 5 times a year. I lost 30 pounds over that first year, slow and steady. Why it helps the heart. Beyond the general advantages of weight loss, fasting lets your body clean house and fixes insulin resistance, a huge driver of arterial plaque. 2. I fired seed oils, canola, soybean, corn oil, all gone. Swapped it for olive oil, avocado oil, coconut oil, grass-fed butter. I improved my diet. I moved toward real food, meat, eggs, veggies, fruit, berries, dates, nuts, and I got rid of the junk food, pastries and sodas and candy. I still sneak a pizza or a Danish now and then. Life's too short for zero joy. The science says these bad carbs and cheap oils cause inflammation. They oxidize in your blood and stick to your artery walls. 3. Back to the gym, 3 days a week. The trainer at the gym recommended different weight machines for each day to focus on particular muscle groups. And I do a cardio mix of treadmill, elliptical, and bike each day. When the weather's nice, I go for a walk on non-gym days. 4. 15 minutes of meditation, Tai Chi, Qigong, every morning. Looks goofy, feels amazing. Studies show it drops blood pressure as much as some meds, without the side effects. And in warm weather, I do my Tai Chi barefoot, outside in the backyard, grounding myself and letting the electrons from the earth flow into my body, which studies show relax the body, decreases inflammation, and actually reduces blood cell clumping, increasing blood flow. I'm not a pill pusher, but these are the ones I like to take every day. I cleared them with my doc, and you should too. First, Kyolic Aged Garlic plus nattokinase, 2 capsules twice a day. They thin the blood gently and help dissolve tiny clots. Berberine, 500 milligrams twice a day. Acts like a natural metformin, lowers blood sugar and bad cholesterol. Vitamin D3 plus K2, 5,000 IUs a day. Keeps the calcium in the bones and not the arteries. Turmeric with black pepper, 1 capsule a day. Calms inflammation, the fire behind plaque. Homocysteine supreme, a complex of methylated B vitamins, 1 capsule twice a day. Lowers homocysteine, a heart stressor most docs ignore. Green tea, 1 to 2 cups a day. Antioxidants protect artery lining. Wobbane, I dissolve a capsule under my tongue. It's an old school plant extract that supports heart pumping and reduces angina. Grapeseed extract, 100 milligrams twice daily. Packed with proanthocyanidins that strengthen blood vessels, lower blood pressure, and fight oxidative stress. Studies show it can drop systolic blood pressure by 5 to 10 millimeters of mercury in just weeks. Annatto GG, 300 milligrams daily. Boost your body's own CoQ10 production, supports healthy inflammation, and keeps mitochondria humming. perfect for anyone on or avoiding statins. Coenzyme Q10, ubiquinol form, 200 milligrams daily. It fuels heart cell energy, protects against statin damage if you're on one, and cuts angina episodes. Clinical trials show it improves ejection fraction and exercise tolerance in heart patients. Cavadex, or cyclodextrin, 1 box, twice a year. An experimental powerhouse, this clever sugar molecule, recognized by the U.S. Food and Drug Administration for its safety and utility, acts like a sponge, slipping into your bloodstream via enema to trap and dissolve those stubborn cholesterol crystals in artery plaques, transforming them into water-soluble forms that your body can flush out through urine, sending the heart-clogging junk down the drain within hours. It's a potential game changer for reversing plaque buildup, backed by mouse studies showing actual artery clearing, and could redefine how we tackle atherosclerosis without drugs or surgery. Yes, via the back door. Don't knock it till you try it. It's made by an Australian company, and it seems a certain industry is trying to make their life difficult. I will put a link to them below. Hopefully, they'll still be around when you check. And today, I might feel a faint twinge if I exert myself in cold weather. Had I felt these tinges back in 2020, I'd have shrugged them off. Context matters. Now, I just slow down, warm up, and keep going. Bottom line, angioplasty is a lifeline for emergencies. But if you catch it early like I did, you can turn the ship around. EECP bought me time. Food, movement, and a few smart supplements kept the promise. If you're scared, overwhelmed, or just curious, you're not alone. Always discuss your plans with your cardiologist before attempting implementation. As mentioned, I'm not a doctor, and your mileage may vary. Some of these changes might sound dreary, and believe me, I was pretty bummed when I realized what had to change. But now, it's a piece of cake, which I still allow myself to eat at a family birthday party or wedding. Drop a comment. What's one change you're making today? Check the description below for links, and check this video here for more natural health tips. Subscribe, tap the bell, and let's keep this heart party going. See you in the next one.